Let's get into the remote physiological monitoring, or the RPM, or remote patient monitoring codes. They're interchangeable. First code is the 99453 for the initial setup and patient education of equipment. It's a one-time billable fee. Okay, it's one time based on that episode of care, and I will elaborate on that a little bit more. It has a $19.32 reimbursement rate. The next code is the 99454. It's for the supply of the device, the collections, the transmission, the reporting. This code is able to be billed every 30 days, and it has a $50.15 reimbursement rate. The next three codes are time spent codes, and I'll talk about that more extensively. The 99457 is for the remote physiological monitoring services. This can be conducted by your clinical staff, your MD, your QHCP. For the first 20 cumulative minutes of RPM services, it is reimbursed at $48.80. And the next code is the 99458. This is the add-on code. So any additional 20-minute increments is reimbursed by CMS at $39.65 per unit. I like to say per unit here and really highlight this because CMS will pay a max of 2 units for the 99458. And in many instances, the commercial payers will pay a max of 3 units. At times, they will request supporting documentation, and once that's obtained, they will adjudicate the claim. Okay. The last code is the 99091. It's for the collection and interpretation of data by a physician or a QHCP for 30 minutes. This code can only be used by MDs or your QHCPs, your physicians or your QHCPs. Your clinical staff could not utilize this code. It has a $54.22 reimbursement rate. I want to talk a little bit about this code. It was restructured in 2021 by CMS, so it is not able to be billed in conjunction with the 99457. It must be billed separately. In many instances, a lot of providers and organizations are migrating away from the 99091 because they're not finding a lot of value in the utilization of it. So please keep that in mind. But we can talk about a workflow of what's best for you. If you are thinking of utilizing this code, really want to talk about some of those billing guidelines associated with it. Okay. There are several billing guidelines, especially when it comes to the device codes, that I want to highlight. So again, just to recap, the 99453 is a one-time billable code, life of the RPM episode of care. So what does that mean? So let's say that you have a patient that started a weight management program. They started in January. By September, they're discharged as they hit their goal. Let's say in November, now they're part of a CHF. They're on for CHF, whatever the case may be. It's a different reason, different diagnoses of why they are back on the program. That would be considered a new episode of care. At that point, you can bill the 99453 if it's related to a different diagnosis and they've been discharged from the program for the original reason. Billing guideline on the 99453, it does require 16 days of reported Bluetooth metrics. So meaning we're getting those readings in based on the devices. So for their blood pressure or for their weight or glucose, whatever the case may be for that patient, we're getting at least 16 readings within a 30-day period. Okay. If the patient has COVID, the criteria is a little less. It's 2 Bluetooth active days during the public health emergency. This rule, even though the PHE is ending on May 11th, this rule will continue until the end of the year. So keep that in mind. 12/31/2023, this rule will change. One other thing to note, the 99454 is also a device code. 1 unit is billable every 30 days. It has that same billing guideline as above, so it requires 16 days of reported Bluetooth active days or Bluetooth metrics, or 2 days for COVID diagnoses. The 99457, this is your time spent code. So this requires 20 minutes of care management and interactive communication. So CMS defines care management as reviewing the dashboard, looking at those metrics that are coming in on a consistent basis, reviewing the patient's chart, along with that interactive communication. So that interactive communication is video visits or audio visits with the patient, talking about their care plan. All of that incorporates that 99457. And again, this code is billable every 30 days. And the last code, it's the add-on code. So the 99458 is any additional 20-minute increments of care management and interactive communication. Keep in mind, this code cannot be billed as a standalone code. It must be billed in conjunction with the 99457. Okay? So for instance, let's say you spent 60 minutes with the patient. You would bill 1 unit of the 99457 plus 2 units of the 99458 to accumulate to that 60-minute time frame. Also to note that incident 2 rules apply, general supervision. So meaning, again, your clinical staff can engage with the patient, but the supervising physician, the physician that you have on the claim, would be responsible for the services for whatever actions have taken place that involve your clinical staff, etc.